بسم الله الرحمن الرحيم. Anatomy of the brachial plexus. Brachial plexus. What means by brachial plexus? And what is the formation of the brachial plexus and the location of the brachial plexus, and finally the branches of the brachial plexus. Brachial plexus, the nerve supply, it is a network of nerve that supply the whole upper limb except the trapezius muscle. Brachial plexus, a nerve supply of whole upper limb. Plexus means network. Plexus means network. And brachial supply whole upper limb. طيب. The brachial plexus, like the tree, have stages of formation. It's formed of first by roots, and the roots unite together to form a trunk. And after that, it will divide. This trunk divide, يبقى division, stage of division. And the division will unite to form cords, and finally branches. طيب. What are the roots of the brachial plexus? Most of the nerve in our body have two parts. Cranial nerve from the head and the neck, from the brain stem, اللي هو 12 pair cranial nerve, and from the spinal cord named spinal nerve, we have 31. And we divide the 31 spinal nerve into 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccyx. So the brachial plexus originating from the spinal nerve, from which specific part of the spinal nerve, lower roots from C5, cervical nerve number 5, and the cervical nerve number 6, and C7, and C8, and finally, after we finish cervical nerve, T1. These are the roots of the brachial plexus, and we can see the roots in the neck, originating from the cervical nerve in the neck. This is regarding to the location of the roots. What happened after that? The C, to form the trunk, the C5 and the C6 unite together and forming the trunk. C7 not unite alone, will form another trunk, and C8, T1 unite to form the third trunk. We have 3 trunks. The upper one, upper trunk, C5 and C6. C7 will be the middle trunk. يبقى middle trunk formed only from C7. And the lower trunk formed by the union of C8 and T1. What is the location of the trunk? We can see in the neck also. So the roots and the trunk, the location in the neck. After that, every trunk will go to the division. And the division behind the location of the division behind the clavicle. Behind the clavicle will be the division. What means by division? All the trunk will divide into anterior division, anterior division, anterior division, anterior division. So the green color here will be the anterior division for the whole trunk. Anterior, anterior. And the brown color will be the posterior division of all. Posterior division, posterior division. يبقى every trunk divide it anterior and posterior. Anterior and posterior. Anterior and posterior. So this is a stage of division, the division behind the clavicle. What happened later? The anterior of the upper and the lower trunk unite together. يبقى anterior of the upper unite with the anterior of the middle and forming a cord. The anterior of the lower runs alone, will form another cord. And the posterior of all unite together, the posterior of the all division and of all trunk will form another trunk, another cord. So we have three cords. What is the name of the cord? Anterior of the upper and the anterior of the middle will forming the cord. What is the name of this cord? Lateral cord. So the lateral cord هو الunion of the anterior of the upper and the anterior of the middle. So the lateral cord originating from C5, C6, and C7. The cord from the anterior of the lower trunk only, from the trunk of the lower cord only, originating will be medial cord. And the medial cord from the lower trunk only, so it originating from C8 and T1. And finally, we have the posterior cord. The posterior cord from the all trunk. The posterior from the posterior division of the all trunk. So the posterior cord, the posterior cord from the all roots, C5, 6, 7, and C8 and T1. So we have three cords: lateral cord, medial cord, and posterior cord. The final stage will be the stage of division. Every cord will divide. Every cord will divide. Every cord will divide. The lateral cord will give 3 division. The medial cord will give 5 division. And the posterior cord will give 5 division or 5 branches. What are the branches of the lateral cord? L, L, M. Lateral pectoral nerve which supply the pectoralis major. Lateral root of median nerve. Lateral root of median nerve. And musculocutaneous. Musculocutaneous nerve which supply the muscle of the anterior of the arm, biceps brachialis and coracobrachialis. So these are the branches of the lateral cord. L, L, M. Lateral pectoral nerve, lateral root of the median nerve, and the musculocutaneous. What are the branches of the medial cord? Will give 5 branches. The same of LL will give M, 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 U, 4M and 1U. The U will be ulnar nerve related to the ulna, which runs behind the medial epicondyle. The lateral pectoral here, so here we have a medial pectoral nerve supply the pectoralis minor and the pectoralis major. هنا lateral root of the medial nerve, so in the medial cord will be the medial root of median nerve. And the remaining 2M will be cutaneous, يعني medial cutaneous يعني supply the skin. Cutaneous supply the skin of the arm, يعني supply the skin of the medial side of the arm, and the other one will be forearm, supply the medial side of the forearm. So they are the branches of the medial cord. يبقى the medial cord 4M and 1U. And finally, what are the branches of the posterior cord along the ultra. Ultra R means radial nerve. يبقى radial يعني related to the radius which supply the triceps. A axillary which is related to the surgical neck of the humerus which supply the deltoid and the teres minor. And upper subscapular and the lower subscapular, which supply the pectoral subscapularis, subscapular, upper subscapular nerve, and lower subscapular nerve, which supply the subscapularis muscle. Finally, the branch to the latissimus dorsi اسمه thoracodorsal. Thoracodorsal nerve. So we have all are the branches of the brachial plexus. The cord and the branches, the location will be inside the content of axilla, and we divide lateral cord, medial cord, and the posterior cord in relation to the axillary artery in the axilla. يعني lateral cord lateral to the artery, medial cord medial to the axillary artery, and the posterior cord posterior to the artery. يبقى we have three branches. Uh, so three branches: lateral pectoral, lateral root of median and musculocutaneous, medial cord, medial pectoral, medial root of median nerve, and medial cutaneous arm, and medial cutaneous of forearm, and finally ulnar. And posterior cord, ultra, upper subscapular, lower subscapular, thoracodorsal, radial, and axillary. All these are branches only from the cord? No. The upper trunk give two branches and the roots will give also two branches. What are the branches from the upper trunk? Nerve to subclavius, subclavius muscle اللي هو subclavius nerve, and scapular nerve, which supplies the supraspinatus and the infraspinatus. يبقى the upper trunk only. يبقى what is the branches from the upper trunk? Two nerve to subclavius nerve, and suprascapular nerve, which supplies supraspinatus and the infraspinatus. طب what about the roots? The roots will give two branches. Long thoracic nerve, which is very important, long thoracic nerve, which is very, very important, which is هنا originating from C5, C6, and C7. This is the coding or the root of the long thoracic nerve, which supplies the serratus anterior, and its injury will lead to winging of the scapula. And also the nerve behind the scapula. What is the name of this nerve? Dorsal scapular nerve, which originating only from C5. So this is the map for the brachial plexus. This is the map for the brachial plexus, formed from roots, trunk, division, cord, and branches. All the branches from the cord, especially the upper trunk, will give two, and the roots also will give us two branches. So the spinal cord will give nerve. What is the name of the nerve? Spinal nerve. We have 31 spinal nerve. As we see here, this is the roots of the brachial plexus, as we see here, from cervical 5, cervical 6, 7, 8, and T1. C and 5 and 6 will unite upper trunk. C7 alone middle trunk. C8 with T1 will be lower trunk, and will be divided into anterior and posterior. The anterior of the upper with the middle will be lateral cord. The anterior of the lower will be lateral medial cord, and the posterior of all will be posterior cord. يبقى we have three cords as we see here: lateral cord, medial cord, and the posterior cord in relation to the artery. This is the stage of the formation. The root and the trunk will be in the neck. Division will be behind the clavicle, and the cord and branches you will see in the axilla or inside the axilla. So any damage of the axilla, the cord and the branches will be affected only. Any damage in the neck will be the roots and the trunk affected. This is regarding to the root اللي هو اليونيون of C5 and C6. C7 alone يبقى middle trunk and the lower trunk. And finally the cords, we have division. بعد كده cord lateral, medial, and posterior cord, and we naming the cord according to its relation to the second part of axillary artery. we have branches from the root C5 and the C6 and the C7 اللي هو long thoracic nerve. C5 alone اللي هو dorsal scapular nerve. This is from the root. From the upper trunk, the roots of the upper trunk C5 and the C6 will have nerve to subclavius and suprascapular nerve. The lateral cord from C5, C6 and C7 اللي هو lateral LLM musculocutaneous, lateral pectoral and the lateral root of median nerve. The medial cord will originating from C8 and T1 اللي هو 4M and 1U, and the posterior cord ultra upper subscapular, lower subscapular, thoracodorsal, radial and axillary. You have to memorize the radial roots from all roots C5, 6, 7, 8 and T1, axillary C5 and C6 only. What are about the lesions of the brachial plexus? We have upper trunk lesion, upper trunk اللي هو C5 and 6, and the lesion of the upper trunk named herpes paralysis. The causes نتيجة fall on the shoulder or trauma to the neck or traction على the head of the baby during delivery. The most affected nerve from the upper trunk اللي هو suprascapular and axillary branch from the posterior cord and the musculocutaneous. This is a branch from the lateral cord. This is regarding to the deformity of the baby. What is the name of this deformity? بنسميها herpes paralysis, and the shape of the deformity like a policeman or waiter tips paralysis. This is the position of the baby, يعني extension of the elbow. Elbow is extended, the upper limb is abducted, and pronation and the medial rotation of the forearm. This is the shape or the deformity of what is called policeman tips paralysis or waiter tips paralysis. Lesion of the lower trunk اللي هو C8 and T1 اللي هو clumpix paralysis due to traction of the baby during delivery from the upper limb or falling أو stretching the upper limb during climbing, or the most common here we have what is called cervical rib. It is abnormal rib originating in the neck, and this rib will make an injury of the lower trunk. And this injury will affecting of the lower trunk. The most affected muscle in the upper limb will be the intrinsic muscle of the hand muscle. And the position like that اسمها claw hand or complete claw hand or flail hand. Claw hand or complete, all the finger will be claw like that. Claw hand or flail hand. It is a lower trunk lesion بنسموها clumpix paralysis. Thank you so much.